let's talk about the recovery from spinal surgery. Specifically, I want to talk about recovery from a lumbar laminectomy surgery. So in terms of laminectomy, first let's talk about what that surgery is. If this is the side of the spine, bone, disc, bone, the laminectomy is essentially the spine surgeon using tools to remove part of the lamina. That's the part that could be contributing to the squeezing of all the neural elements down this tube. So what I let my patients do after a laminectomy is usually I actually let them go home that day. They can go home that day, up and walking that day, and I usually tell them be up and walking around their room, their hotel room, their house several times a day during those first couple days. I let them know they can go out and take walks around the block, and I kind of say just don't get your heart rate up too much. I don't really want you sweating into that area. The restriction I have in terms of activity for those first 6 weeks is I really don't want the patient lifting anything more than a milk jug during those first 6 weeks. We also use the phrase BLT, and I want them to avoid bending, lifting things, and twisting. That's just for those first 6 weeks. That helps stabilize the muscles on the back, the tissues, and the stitches I place that are all absorbable under the skin during those first 6 weeks of recovery. Also, typically, I'm going to have the patient be in a Velcro back brace. It's a medical grade back brace that provides an extra level of support to the front, side, and the back part of the spine. And that's something that does help with post-operative pain. Another thing I have the patients do is I say once you get home, you wait about 2 or 3 days after the surgery, and I want the patient at that point, day 2, to be showering with just soap and water on the back. I don't want them to get fully submerged into a bath, a hot tub, or even a lake we have here in Texas, but I do want the patient to be using soap and water to clean their incision, clean their wounds, and to be changing their dressings essentially every day. During that 6 weeks, frequently I'll order something called home health, and that's where you have a home health specialist do light physical therapy with you. They'll do light exercises, stretching, they'll also do medication management and check the wounds. And I think that's a really helpful part for patients that either live alone or maybe don't have a great medical background to have an extra medical specialty person there helping you. At 6 weeks, following a laminectomy procedure, I almost take off almost all restrictions. Now again, this varies based on patient. If you are a MMA fighter, you're trying to go back to that at 6 weeks, well, you might be able to do that, but I'm not sure if that's my first recommendation immediately. But if you're someone who has a somewhat more sedentary job, not an extremely active lifestyle, and you're in your 60s, 70s, or even 80s, you could probably go back to almost all things you like to do at that 6 week period. I typically like to start some formal physical therapy for several patients, and again, this just is based on your age and what type of physical activity you came in with, but I'll start that at 6 weeks, and that's after the laminectomy surgery. So for most patients, after 6 weeks, I do take off most restrictions. I want them to go back to the gym. I want them to go back to exercising. They can go back to cycling. They can go back to running. If their incision's healed, they can submerge in water. Again, this varies a little patient by patient, but I tell patients usually by 6 weeks they can go back to most things they like to do. Definitely by 9 weeks, patients are feeling extraordinarily good and they're going back to many things they like to do, definitely way before that point. So that's just one of the things I tell them. The recovery varies from patient to patient, but on the minimally invasive laminectomies, especially the 1 and 2 level laminectomies, it's a little bit of a downtime, but patients really bounce back quickly. I expect them by 6 weeks to get back to almost all activities they like doing.